Well, I did a year of research, and I would go around, I'd look on the internet, I would call, and finally I found some of the top doctors in Louisville and asked them who they would suggest for their family members, and it always came back to Dr. Banis.
My husband managed a university surgical group where Dr. Polk was the chief of staff, and Dr. Banis was on staff there as well, and my husband knew Dr. Banis through that group. And even long after my husband had left the group, he still thought highly of Dr. Banis and wanted me to see him for things that needed to be removed on my face, and that's how we got here.
I did some research before I called anybody to make a consultation, and I just couldn't go anywhere else. You know, everyone that had previous procedures really recommended Dr. Banis, so I just had to come see him for the consultation first.
I wanted to definitely find a doctor who was excellent in what he did, and I didn't know anything about Dr. Banis, and so in making an educated decision, who am I going to for this reconstruction, I called the Jefferson County Medical Association and followed up on his credentialing, followed up on his referrals, where he's been, what he's done, his education, the type of work he does. I had a whole list of questions for the Jefferson County Medical Association and got nothing but excellent remarks. And just as a comparison, then I called and asked those same questions about some of the other physicians in town. Not all physicians are created equal. They might be board certified, but they're not all created equal. And it really pays to do your homework and to follow up.
Some of my main concerns were myself. If I did the procedure, would I be okay with it? I was also concerned about what other people would think going through the procedure, because it is plastic surgery.
You know, so many people look at plastic surgery, the whole field, as a negative, as in just a negative field. You know, why would you want to do that? Why would you want to spend the money to change anything, you know?
I think people have a false understanding of plastic surgery, and they think that if someone is going to have plastic surgery done or is interested in plastic surgery, they're an extremely vain person, that they are very consumed with themselves, and they might not understand there's other reasons behind that, you know, childhood traumas or just the way you grew up.
I was concerned about family and friends. I was concerned that they would judge me because they thought I wanted to look perfect, and that's not what I was going for. I just wanted to look better.
I get so many patients come in and tell me that they feel that they're not a vain person and that it feels unnatural for them to be here and to be coming to talk to Dr. Banis. I try to tell them that it's not a level of vanity, but it's a level of feeling better about yourself. And if you feel better about yourself, you feel better about your relationships and your life in general.
Vanity is a word I wish I could banish. We have so many people coming into this practice who are concerned with the issue of perceived vanity, and it's not really an issue with 98% of them. What they're really saying is they would like a better self-image. They'd like a better body image. But this isn't vanity. Positive self-image is something that is making many motivational speakers millions of dollars every year. And this is what this type of surgery and self-improvement is all about. It happens to be achieved by surgical methods. But I wish we could just banish the word vanity from the dictionary for purposes of this practice.
I was afraid I'd look like I had a procedure done, and I wanted to look completely natural. I didn't really want to share the information with anyone. I wanted to just look better than I already look. I wanted to have more self-confidence than I have, or had, I should say. So I just wanted to look very, very natural. I did not want to look stretched or pulled or tucked, and Dr. Banis did just that. It just made me better and made me feel better.
My husband was concerned because he had seen women that were very obviously done, that had had plastic surgery before, and it was obvious, and he didn't like that. He didn't want it to be obvious, and he wanted it to be natural, and I think he was put at ease when he came in with me for the initial consult, and he saw the size that I was going to go with, and he was comfortable with that, and now he loves them. Can't keep his hands off.
We are aware that some patients are afraid to be too big or too tight and have an operated look. Dr. Banis is very good technically and wants them to give the most natural look possible.
In fact, one of my priorities is to achieve a non-operated look for our patients. My patients are not coming in to shout, "I have had an operation." They want to look natural. They want to look rejuvenated, rested. They want to be able to wear their clothes more comfortably. They don't want to shout in any way that I've had an operation. This isn't Hollywood, and there certainly are reasons some people may want that effect, but not in our population.
To be honest, I have watched those shows, and I do see them. Dr. Banis is just way above them. If they could come in and do a show on him, it'd be a hit. It'd be number one. What he could show them is the passion, the professionalism, and the quality of his work is just number one.
I think Dr. Banis is different because it's about making you feel better as a person, not making you look like a Barbie doll or a Playboy bunny or anything like that. I mean, he talks to you about your personal life and why do you want this certain procedure done and what results are you expecting. He doesn't want you to have unreasonable expectations. He wants you to understand the procedure, know what the results are going to be, and then make the procedure work for you so that you are more comfortable in your own skin. It's your skin and you need to be comfortable in it, and he's able to do that.
First of all, Dr. Banis wouldn't do anything that was going to look outrageous because he made that pretty clear to me. Not that I wanted to go like that, but I don't think he would do it. If it was going to look too fake or too ostentatious, I don't think he would do it. He would tell somebody they would need to find someone else. I honestly think that he's like that. Now, if it was their livelihood or something, maybe, but I don't think that he's that type of doctor. He wants people to look as natural and as good as they can.
One of the things they can always be assured of is we're not going to do anything that is going to not be in their best interests. We won't take them too far, and we won't take them anywhere if I can't be sure that they're going to have a good outcome.
One of my procedures, I've had some work done on my face, and I was terrified that I wouldn't be able to trust the doctor doing it. And but I had none of those worries with Dr. Banis or Abby. So they both have been fabulous, and they've made me feel better than I thought I ever could feel.
I didn't want a dermatologist to mess around with a scalpel around my face. And that's when my husband said, you need to see a plastic surgeon. And when we came to see Dr. Banis, he was totally made me feel at ease. He said, oh, you'll never even see the scar. You'll never know that there was anything there when I'm done. And you can't see anything, can you?
I had a lot of friends and family members who said, oh, why are you going through this huge surgery that's taking 13, 15 hours to reconstruct? Why don't you just do this? Why don't you do that, something simpler? And they were fearful for me making it through that big of a surgery. And it was a huge surgery, but I had so much confidence that Dr. Banis knew exactly what he was doing, that he was going to do a beautiful job, and he would do whatever it took to make it work correctly, to make it work right. And he didn't cut corners. He did exactly what he needed to do to give me the best results that he could give me.
Safety is the most important thing in this practice. Cosmetic or aesthetic procedures are by definition not necessary. They're not life-saving, they're not function-saving. They're certainly psychologically important, but safety is absolutely paramount to do these things. I personally couldn't continue doing a elective cosmetic practice if I were having any significant issue with safety. So we assess every patient for their overall physical health and well-being, and then we do things with the highest safety standards. We do things with the assistance of anesthetists whenever there's major anesthesia to be administered, so that I don't have to be thinking about the anesthesia, and I have a separate professional monitoring the patient's vital signs and the well-being of the patient under anesthesia. All I have to think about is doing the procedure technically to the best of my ability. My staff and I understand that taking that first step of making a phone call and scheduling a consultation is a huge step for a patient, and it involves some very difficult things for many patients, in that it often can involve bearing their soul, bearing their body about secrets that they've held for many years and finally decided they want to change, and they're going to take this step to change, even though it's personally very challenging for them.
Coming in, I was nervous, scared. All those things I think a woman feels when, or he or she comes into the office. And it just went wonderful. They made me feel at ease. They made me feel comfortable. The whole staff is just absolutely wonderful.
I think what our practice does better than any other practice in this area is to provide a warm, caring environment for our patients, better education than any other practice that I know of, and I think we have better staff than any other practice that I know of.
Coming into Dr. Banis's office makes you feel like you're going into his home. Everyone greets you, treats you with the utmost respect, welcomes you, and it's a very nice, warm environment. It's not a sterile doctor's office environment, and it's very comforting, because a lot of women are very upset at this time, going through reconstruction of various types, and it's nice to feel warm and comfortable.
Our philosophy is that the patient comes first, and I think in general we carry that out. There are some days when we sometimes feel a little bit more hectic, but in general I think our patients feel that, and that's certainly what we want for them.
You always, wonder, oh, are they going to look at me like, what is she coming here for? Why would she want to change anything? And I think you feel that people are going to judge you or be judgmental. And they were really nice, just helped you, fill out your paperwork and get everything together that you needed. The staff in general, it wasn't like I expected. They were really nice too.
The environment is always friendly. They always know who I am when I walk in. I feel like I'm their only patient. I feel like, who else is there coming to this place, because they treat me like I'm their friend. They have, they ask about my personal life. They remember what was happening last time they saw me, and ask about my daughter and my vacations, just everything. And it's just it's like coming to see your friends, It's like, oh, you kind of want to find a reason to come back to the office more than you probably need to, just so you can see everybody.
The consultation is probably the most important part of this whole process, because in the consultation we find out what is the problem and we develop a plan to achieve a good outcome.
It's very difficult for them to come in here because they're going to show something they don't really like. And, we just talk to them about other patients' experiences. We let them know that they can talk to other patients if that's what they'd like to do. And we just try to talk to them like we would want to be talked to, just face to face, and know the facts and make them feel as comfortable as possible.
They achieved that more than I could ever imagine. Abby was wonderful. I sat with her, and within 5 minutes, I was opening up to her.
Abby is the best. I love her. She is like having a girlfriend that you just come to the office and she makes you feel so good.
I try to look at every patient that comes in the office as a sister or a friend or a brother, and try to make them as comfortable as possible, because once we make them comfortable, they're going to be able to let us know exactly what they need from us, and we're able to tell them exactly what we can give to them.
She asked me what my fears were, my concerns, what I expected, and I told her, and she told me her expectations too out of me.
It really helps to have Abby come in, and because she is a female, I felt it kind of loosened me up a little. I could ask her some questions, and then this is what they do for a living. They're comfortable answering any question that you have, no matter how bizarre I may think it is. And then when Dr. Banis comes in, you're like, oh, Abby already answered these, and so it's definitely more comfortable to ask him some of the personal questions too. Especially it is one-on-one too. That helps a lot.
We consider it our goal to, within 15 minutes between my staff, Abby, and myself, to have set these folks at ease. And she sort of warms them up and softens them up. And then if I can't have them relaxing within about 15 minutes, then I'm doing something wrong, or they're a very hard nut to crack.
He just came in and made me feel at ease, immediately, because he's just so nice, and he makes you feel like he has nowhere else to be but with you at that moment.
Well, he sat with me and was asking me questions which a lot of doctors don't have time to do. Asking me, what is it you want to accomplish? And it was flowing so easy that I just felt so comfortable to tell him about the reasons I was here with him.
You don't even feel intimidated by him. You know how you feel intimidated by some doctors because they're just like, they talk to you like over you sometimes, but not Dr. B. He's so nice and so warm and so genuine.
He comes with very, very high credentials. But when I came to meet with him, not only did I know that he was very well educated and had lots of experience behind him, he talked to me from the voice of experience. I could tell he was not textbook language about what he could do and what the pros and the cons were. He was talking from hands-on personal experience that he has had and has developed over these years. That gave me so much confidence and faith in him that he was going to be the best doctor that I could find.
The focus here is not me. It's that client, that patient that comes in asking for help. And if that's your baseline, then what they need is your time. They need your time to educate them. They need your time to listen to them, to find out what their actual objectives are, what their problems are. And in fact, they often really don't know until they start talking to you.
He respected me, he was empathetic, and treated me with dignity, and educated me about all of the pros, the cons, the options, and he was just wonderful. So I knew when I came to Dr. Banis and we sat down and talked about all of this, I knew he was the right surgeon for me.
The most important thing to do at the beginning of the consultation is to talk to the patient about their history, gain their trust, let them know what's going to happen the whole time that they're here. It's not a matter of just coming in for surgery, but what we're going to discuss with them, things that we're going to go over, risks and complications, pre and post-op expectations, and then Dr. Banis will come in and examine them. And then afterwards we give them financial information, and they're able to go home and digest that information.
In this practice, it's education, education, education. If I can educate a person well enough, and education is a broad subject, obviously, but if I can educate them, we can educate them well enough to understand what they need and what will achieve their ends, then I've got a great patient to work with. And I'm going to have a happy patient and a good outcome, because I'll have a patient with reasonable expectations. They'll have an understanding that complications and side effects can occur. They'll understand that they can generally be corrected, and they will understand that secondary surgeries may be necessary to achieve their end.
It is probably the number one thing that is important to Dr. Banis. We try and make sure that our patients know everything. We want them to make this decision not only because they want to do this, but that it's the right thing to do for them.
Yeah, education was definitely important here. Abby, went over everything that I wanted to know, and then Dr. Banis also too. I think that they really wanted you to know what you were getting into before you, committed to do it.
it's very important for women to be presented with all of the options that are available, not just some of the options, because if you make a decision based on only half of the knowledge, you're going to live with that the rest of your life. And you need all of the information so that you can make the best decision for you.
I think that there's a lot more education out there, and a lot of people come in very savvy. They come in well educated and have read a lot about the procedures. They know a little bit about a lot of things. And what we can make the difference is telling them a lot about the one thing that they're really wanting to improve.
So there was a lot of aspects of plastic surgery that I did not understand. And Dr. Baines explained all of them to me. I could not ask too many questions. I never felt like he was watching his watch and that I needed to, hurry up and get done so we could get on with the next person.
He mapped everything out just beautifully, and it wasn't a 15-minute appointment where you're in and out. Yes, we can do reconstruction. Here you go. Dr. Baines takes all the time with you that you need.
We spend so much time with our patients, and they tell us that all the time. They say their consultation with another physician was maybe 20 minutes, and ours will be like an hour and a half, and we have a lot of follow-up afterwards. And I always tell them, call anytime, and that's what we're here for, is to answer all their questions, to make them feel so comfortable with what their decision will be.
We can achieve a lot with almost any patient. Almost any patient can be a plastic surgical candidate. But the trick is to develop a reasonable expectation for the outcome with the patient. So to do that, once again, education. What are the expectations going to be? What kind of result are you going to be able to enjoy?
Integrity and honesty are I think those are probably the two key things that are in this office. Honesty, 150%. You're not going to be told something that you can't believe in.
I really didn't have all that many questions at the end because they followed through with everything they said that they were going to do. They let me know beforehand everything that was going to happen, and it did, and it was just smooth.
These are people to us, they are not numbers. And we like taking the time, we like educating them, we like bringing them into the fold so that they can feel empowered enough to go forward with this change that they've envisioned.
To have a physician that takes the time with you to explain everything that you need to know, the pros and the cons, the different options, so that you know what you're going into when you go into it, it's wonderful, and every woman should have that.
We need our patients to know and have the confidence that we're going to be with them, working with them through to the completion and a successful outcome. If they stick with us, we're going to be with them all the way.
I thought that the surgery itself and the recovery would probably be pretty rough. So I was expecting it to be really bad. It was nothing. I had surgery on Wednesday, and I went back to work the next week. We'd started school, so I was having to deal with a bunch of children, and I was up and out. And actually that weekend, I'd gone to ball games all weekend, so probably shouldn't have done too much, but I just didn't feel any pain. There was some swelling, but it went away, and it was just absolutely wonderful. No pain, really no pain.
I had been explained all the things I could feel, the repercussions of the surgery that I had, and that was scary, but I felt safe in knowing what to expect. I felt very comfortable. When I came out of surgery, the first few hours were hard, but it was exactly as I expected it to be. But as the days went on and things improved, it was way better than I had ever imagined.
Coming out of surgery and waking up in the recovery room, I remember feeling like a Mack truck had just run over me. And I thought, for just a moment, I thought, oh my goodness, what have I done? And as soon as I thought that, then I told myself, it's okay, because I knew I was going to feel like a Mack truck had just hit me. I'm supposed to feel like this, and everything's on schedule because I'm feeling exactly like I'm supposed to feel right now, which was just horrible. And at that point, of course, the nurse saw that I was awake and, gave me some additional medicine to comfort me and take me out of the pain. Dr. Banis was there working on me for 13 and a half hours, was probably there a total 15, 18 hours to get me through the surgery. And the next morning, he was there bright and early checking on me, checking, how are we doing? How are you feeling? Let's check and see this transplanted tissue. Is it taking? How does it look? The tissue was monitored 24 hours a day, and he was in there at least twice, maybe 3 times every day when I was in the hospital, also monitoring and wanting to check to make sure that his surgery was going to be perfect.
My physical results have been absolutely wonderful. They have surpassed what I ever imagined.
By the time I got into Dr. Banis' office for him to check me out, I was actually giddy that I felt so good. I said, "Look at me! Look at how good I feel!" And he was so shocked. He said, "Rhonda, you are doing so good," and I was. It was amazing. I was so shocked.
I really like to know the anatomy. I think I know the anatomy well, and this is very important for a surgeon to allow you the precision to do the operations that you want to do well, predictably, repeatably, and get good results every time. And that's what our patients need.
It's very easy for me to support him, and I know technically he is so good at what he does, he's going to give them the results that they want.
The first week, I was just in awe. I would just, stare at myself. I had been wearing clothes that I hadn't worn, well, probably never worn, because I was too embarrassed and ashamed and kept covered up.
I look better in my clothes. My husband just, he just loves it. So I wouldn't change it. I would do it all over again. If I had to do it again, I would.
I have a waist, and that was one of my main goals, is not to be skinny per se, but I wanted a waist. I just wanted a womanly shape, and I got that.
I'm much happier when I get dressed, put on my clothes, and more than anything, this summer at the pool was awesome. I saw Dr. Banis about a month ago after pool season was over, and I just came and gave him the biggest hug. I said, "This has been the best summer I've had since I was a teenager." I felt so good.
I went into medicine to become a family practitioner. So I still have, I think, deep down that concept of wanting my patients to be healthy, to feel good, to be healthy, and I happen to get into plastic surgery, and that involves the issue of looking good. And we know that looking good is a huge component of how you feel about yourself. Good body image leads to good self-image, and I see this every day.
It was a self-confidence issue, and things that really bothered me, and that's why I really did my research to go check it out. And really it was I just wanted to feel better about myself, so I did my research and came here.
I had kept myself covered for years. I was embarrassed, ashamed, all those things that go with that. So I had a lot of things holding me back. That's the one wonderful thing about Dr. Banis. When I came in, I told him up front, this is one reason why I want to do it. He was passionate about it. He was understanding. It was more therapy for me than anything. I feel like it has completed me whole.
The outcome of this, I feel like I'm a better person on the inside, and I feel like I look better on the outside. The particular type of reconstruction that I had, I now have a flatter stomach because we put that excess tissue to good use. I have a much shapelier breast than after the breast that I was left with after nursing 3 children.
One of the things that many people say is that plastic surgery or cosmetic surgery is psychosurgery, and they say that as a put down. In fact, cosmetic surgery is psychosurgery. We're not achieving functional results in general. We're not taking out a gallbladder. We're not taking out an infected organ that can kill you. And so what we're doing is we are operating on a visible part to achieve a psychological result. What is that result? It's to make you feel better about yourself. If that were not the goal, we wouldn't be doing any surgery, if that weren't important. And the fact is that all studies will show that those psychological results are huge and they're very real.
You know, it wouldn't matter how much better I looked if I still felt the same. So I think that definitely feeling better about myself was a big, big part of going through with this.
I just feel better about me all the time. And as I said before, that when you exude that confidence, it affects everyone around you. It's like it's a smile, it's contagious.
The person who has a positive self-image goes further in the world. They do better, they are less inclined to get bogged down by their own poor feelings about themselves. They emote better, they perform better. And we see this again every day.
I definitely feel more confident to do things that I before would have just, not wanted to do. And I feel more confident in front of people. I feel like, I'm just as good now too.
I don't feel beat down anymore about my body. And I know that I can do pretty much whatever I want to now because I went through with the procedure. I was scared, frightened. He eased my pain. It made me feel very comfortable enough to just go through with it all, and I would do it over again.
I just feel like I've come through this with flying colors, and women don't have to be concerned that this is the end of their life or the end of their being sexy or beautiful. You can come through this and be even better than you were before.
I think that, if something small is going to help how you feel about yourself and just how you present yourself daily, why not? If something like plastic surgery is really going to help your everyday life, then I think that you should definitely at least consider it.
Because it's just made such a difference in my life. For me personally and my family, for my husband and I both.
I've seen other doctors' offices. I've spoken to many other doctors. I've spoken to many other friends, and there's nothing like this office. And I tell anyone who's interested, please just go visit. It'll change your mind.
I wouldn't hesitate for 1 second about sending people here, and I haven't. I've given the name out to many people, so it was a great experience all around.
I really thought the world of Dr. Baines in the first place, and now I don't know why anyone would even, after meeting him, go anywhere else. I think he is a phenomenal doctor. I think he's an incredible person. He's just a fabulous man, and I have a huge amount of respect for him, and I trust him very, very much.
People often ask me what my favorite operation is or surgery is, and my answer is easy. It's what operation the patient needs, because my goal is to have a satisfied patient. I want the patient to walk out of this office after we've helped them out knowing that they've gotten the results that they want. And so it's really not the operation that makes me happy, it's the happy patient that makes me happy.